Right, hello and welcome. I am Dr. Peter Solomon, chiropractor. I'd just like to do a little talk, a little discussion, a little conversation about a lumbar disc injury, or lumbar disc injuries, just to talk about the basic components of the commonmost, the symptoms of a disc injury, and if you are having them, if you're experiencing them, and so that you can go and seek the correct care. So when we're talking about a lumbar disc injury, we're talking about the lumbar area, which is the lower back. And so the first thing, obviously, is lower back pain. So are you experiencing lower back pain? So a lot of people will refer to their back pain as sciatica or lumbago or some other interesting terms. But typically, sciatica is a very specific description of pain, which is pain traveling down your leg. So low back pain is definitely a component of a lumbar disc injury. Maybe not the most important component, but definitely an important component. The differentiating factors with a lumbar disc injury, specifically a disc bulge or a disc protrusion, extrusion, whatever, is the fact that the disc has torn. And not only has the disc torn, the disc material has leaked out and has leaked onto the nerve root, the corresponding nerve root for that level. So you've got 5 vertebrae in your lower back, you have 5 lumbar discs. The ones that typically blow are the L4 or the L5 S1 discs, and they would then create pressure. The disc would tear, the disc material would leak onto that corresponding nerve root, and typically it's either left or right. It's rarely are you going to get it on both sides. Yes, you can get it on both sides, but it's typically one-sided. You could get a broad base disc bulge that bulges more posteriorly, which is just backwards as opposed to left or right, and that could impinge both nerve roots or put pressure on both nerve structures, and you could have pain or symptoms in both legs. So low back pain is one of the common symptoms. The other box to tick if you think you've got a lumbar disc is leg pain. So are you having pain in the leg? And specifically, if you're having pain in the leg, are you having pain below the knee? There are a lot of other things that can refer pain to the upper leg, the buttock, the thigh, the hamstring, the groin area. But the one differentiating factor with the lumbar disc is that it's going to refer pain below the knee, especially into the foot. It's going to be an electrical kind of pain. Your nervous system is essentially your electrical wiring for your body. So when that short circuits or when there's an issue with that, you are going to feel like you've been shocked. Typically, it's quite a rude awakening. It's quite a sharp pain. It's quite an electrical kind of charge down your leg. And there are certain areas in the leg that you're going to feel it. So the specific nerve roots will have specific areas that they'll refer pain to. So you'll have low back pain. You'll have leg pain, specifically below the knee and into the foot, often into the foot. And then accompanying the pain, you'll more than likely have some pins and needles or numbness in that same area. So, for example, the L5 nerve, if that's being pinched, you would more than likely have pain down the back of your leg and into your foot. Whereas an L4 nerve root impingement, you'd probably have pain down the front of the thigh, crossing over the knee, into the front of the shin, that kind of thing. So, which is why your doctor is going to ask you very specific questions about where you're feeling your pain. What does your pain feel like? Is there pins and needles? Is it left-sided? Is it right-sided? What positions alleviate the pain? What positions provoke the pain? That sort of thing. So the biggest thing with low back pain, which is disc-related, would be the fact that there's referral into the leg, into the lower extremity, below the knee and into the foot. There's pain, pins and needles, and the pain is kind of electrical kind of pain. If it's kind of pre-disc herniation or pre-disc prolapse, you could have pain into the leg, but typically then it's above the knee or it's into the buttock, it's into the upper hamstring, and it doesn't have that typical kind of that typical electrical pain, that typical pins and needles. So I'm going to pop some images up here of some discs that have gone. You can see in this first image there will be, I think the disc is outlined, so there's in red, little red circles around it. The white substance is the nerve structures, the spinal cord and the nerves. and you can quite clearly see how that nerve or those discs have protruded backwards into into those nerve structures. On this next image, the disc is circled with the little red circle. Well, actually, it's got a little arrow pointing at it. Again, you can quite clearly see how that disc has protruded backwards. So there's a lot of reasons why your discs blow. Typically, it's loss of sound movement patterns. Your discs become loaded incorrectly over a period of time, and they essentially wear out and they blow. So they are your shock absorbers, and they are there to bear weight. And once they start to degenerate, or they become injured or torn, or you've abused them throughout a physical life, or you who knows, maybe you're just out of shape, you don't have the supporting structure to reinforce those discs, then they degenerate and they take load that they can't deal with. So we can get into that in another video, but the main takeaway from this video, if you think you have a lumbar disc injury, you will more than likely have low back pain, you will more than likely have leg pain. The leg pain will be below the knee, predominantly into the foot, into the shin can often be quite painful, into the calf can be quite painful, and there's associated pins and needles and numbness in that same area. And then often too, like in the middle of the glute, in the middle of the bum muscle too, almost in the area, like the mid buttock area, you would have a focus of pain in that area too. So yeah, that's just a basic overall of what do I have a lumbar disc injury, and we'll get into the other details of the characteristics of different types of disc injuries in another video. But hopefully that helps you. And helps you get the correct treatment. The correct treatment is to decompress that nerve, or decompress that disc. The disc damage is because of compression, and so essentially you want to decompress that disc. You've got too much pressure in that disc. That disc is under a lot of pressure. Disc material is leaking out of that disc. The way you're going to fix that is by decompressing that disc. You can do it conservatively, which is the technique I use, which is the traction method, and surgically you're going to be doing that with a surgical decompression. Not everyone is amenable to a surgical decompression, and likewise not everyone is amenable to a conservative traction decompression, depending on how bad the disc is. And that's a conversation you need to have with your specialist or your doctor, and figure out if you are, what kind of candidate you are, what you are a candidate for. So again, I hope that helps you. Please pop me a like. Any comments, leave them below. And try keep leaving good information for you to help navigate your health quest and conservative care plan. All right. I am Dr. Peter Solomon, and I will talk to you again soon. Cheers.